Ever wondered how varicose veins form?
Varicose vein is a big dilated vein, usually in the lower extremities. It's associated with something called chronic venous insufficiency, which is an inflammatory process, and it can lead to all kinds of trouble, so you should definitely check it out.
Vein damage and unhealthy veins requiring vein repair can be due to a number of factors. The veins in the leg have a difficult job, carrying blood that has been used by the tissues up against gravity back to the heart. The veins do this using something called valves. In certain circumstances, however, the valves become dysfunctional and leak, and the increasing pressure can lead to the formation of spider and varicose veins that may require vein repair.
Veins need your muscles to contract to push the blood back to the heart. So if you're too inactive and you're not exercising and you're sitting all day, chances are you're going to develop some varicose veins or spider veins.
Can you tell us the best way to prevent it and the best way to treat it?
Prevention is a little bit hard because it runs in families, but keeping your weight low, staying active, wearing graduated compression stockings, especially to the knee, those are all good things. Elevating your feet at night, trying not to sit and stand too long at work.
For varicose veins, it's usually an inherited factor, but what can compound it even more is if the person's constipated, that puts pressure on the legs. If a person's carrying too much weight, it puts more pressure on the legs. It's very important to massage the venous system. You see, the arterial system comes away from the heart, the venous system comes back to the heart. And our second heart that stimulates our venous system are our calf muscles. And so any exercise that really uses that calf muscle is excellent for varicose veins. So that's rebounding, exercise bike, swimming, but that person should not do running.
Number one best remedy for vein problems in your lower legs is this red vine leaf extract. And I found this data in a patent where they had all this additional research. And of course, this patent was probably based on the huge study they did. It was a randomized, placebo-controlled, double-blinded clinical trial on quite a few people who had mild to moderate venous insufficiency. Now, the amount of red vine leaf extract that they used was between 360 to 720 milligrams per day for 12 weeks. And the results were significant. Red vine leaf is also good for an enlarged liver, an enlarged spleen, swelling in your legs, hemorrhoids, bruising, bleeding, nasal congestion, capillary thickness, and it's a great anti-inflammatory. And it also helps to balance the permeability within your capillaries. And the other thing I would recommend is to start doing the rebound exercise, simply because that's going to start increasing lymph flow and help push some of this fluid through your veins. And of course, I would definitely recommend doing walking on a regular basis. You want to keep active. You do not want to do a lot of sitting. You don't want to do a lot of standing.